Right, good evening everybody and welcome to this special meeting of the Resources and Services Overview and Scrutiny Committee, and it's one of those interesting meetings because we've also invited members of the Community Leadership Overview and Scrutiny Committee to join us as well, so welcome to this committee. Right, apologies then, item number 1 for absence and substitutions.
Thank you, Chairman. We have apologies from the committee chairman, Paul Honeywood, and he has appointed Councillor Maurice Alexander as his substitute for this evening. And we also have apologies from Councillor Doyle, although there is no substitute for her. And I'm sure we'll check the record, but it looks like we've got apologies from Councillor Harris and that Councillor Bush is substituting for him.
Right.
Thank you, Chairman.
Okay, thank you for that. Right, we move on to agenda item 2, minutes of the last meeting. And before I ask someone to move those minutes, I think you may want to make a comment on item 74.
Thank you, Chairman. So at your last meeting, you were due to consider the projects report submitted by the leader, and unfortunately the leader wasn't able to attend. So the chairman was tasked with writing to the leader to express the committee's view that they would like to see him attend and talk to that report. And I think there were also then subsequently during the meeting matters concerning the Spindles project that the committee wanted to address with the leader. So the chairman the chairman of this committee wrote to the leader of the council on the 22nd of April, expressing those views, as I say, and the leader then wrote back on the 12th of May, fundamentally indicating that he would attend your next ordinary meeting, which will be on the 1st of July. So those items, the project report and the opportunity to ask questions in relation to political elements of the Spindles unauthorised expenditure situation will be asked, or the committee will have the opportunity of asking those questions at the 1st of July. So, Chairman, it's just an update on that to say the chairman of this committee did write and the leader has responded, and that on that basis you can look forward to those items appearing on your 1st of July agenda.
Right, thank you for that, Keith. And can I now have a mover for agreeing the minutes? Graham? Yeah, lovely. Right, we move then on to agenda item 3, then declarations of interest. Councillors are invited to declare any disclosable pecuniary interests, other registrable interests, and the nature of it in relation to any item on the agenda.
Chairman, if I may just further to the apology for absence from the committee's chairman, Councillor Paul Honeywood. That was because he had a relative received services, and therefore there is an interest there. And for completeness or sympathy, he felt it better if he didn't attend this meeting on that basis.
Right, thank you for that. Move then on to agenda item 4, process pursuant to accountancy procedural rule 38.
Chairman, there are no such questions.
Right, we move then on to the main item of business, item 5, report to the corporate director, planning community. Gremlin in the system. Care Helpline Transfer, Emerging Transition Plan.
Might need to talk up.
Right. There's something recounting things, isn't there? Right, so we move on to then agenda item 5, report of the Corporate Director, Planning and Community Careline Helpline Transfer, Emerging Transition Plan and Heads of Terms. And this is on pages 15 to 66. And this is for the Resources and Services Overview and Scrutiny Committee to consider and comment on emerging proposals and send potential recommendations to the portfolio holder for partnerships in respect to the transition plan for implementing the Cabinet's 21st of February 2025 decision on the future of tendering Careline service, as well as the heads of terms for the associated legal agreement with Colchester City Council and Colchester Helpline Amphoria. The overarching priority for the transition plan will be to maintain service quality and service continuity and to minimise the disruption and inconvenience to service users, many of whom are older and vulnerable tendering residents. Consideration of the Careline transitional arrangements form part of the committee's 2024-25 work programme. The emerging transition plan and heads of terms have been the subject of negotiations with Colchester City Council and Amphoria and have been informed by ongoing engagement with services across the council, consultation with staff and professional legal advice. The proposals within this report have been discussed with the portfolio holder for partnerships, leader of the council, chief executive and senior officers from the council's management team. Following the consideration of any comments and advice from Resources and Services Overview and Scrutiny Committee, it would be the intention to seek the portfolio holder for partnerships agreement to finalise the transition plan and formally enter into a legal agreement with Colchester City Council and Amphoria in July 2025, and to then deliver the Careline Helpline transfer into August 2025. But as we go through the questions that we have for the portfolio holder later on, I'd just like people to councillors to consider what recommendations they might want to put forward to the portfolio holder for us to write the recommendations up at the end. So on that basis, I think I'll hand over to Councillor Lacey to set the ball rolling, and we'll get on with it.
Right, thank you, Chairman, for inviting me to this committee meeting. I'm very pleased to be here this evening, and I'd like to thank members from both of our scrutiny committees for attending. Your presence sends a strong message to our residents and partners about how seriously we take transparency, accountability, and the importance of the decisions we're discussing this evening. Back in February, following a year-long review and a wide-ranging consultation with stakeholders, Cabinet agreed on the future direction of our valued Careline service. The decision was to move towards a more integrated telecare response and lifting service for North East Essex. This will involve transferring our service users and staff on their current terms and conditions to the helpline service run by Amphoria, Colchester City Council's trading company. This also includes out-of-hours call handling and CCTV monitoring. This is a real good news story. The merger supports the goals of the North East Essex Health and Wellbeing Alliance by promoting a more joined-up approach to care. It reflects what our customers have told us they want: stability and continuity. It protects jobs for our dedicated staff, and it prepares us for the future, where councils will increasingly need to work together across wider areas to deliver services efficiently as part of the coming local government reorganisation. Of course, making this happen smoothly is no small task. There are many moving parts, and that's why we need a clear transition plan and a set of heads of terms to guide the legal agreement behind the transfer. Thanks to the hard work of our officers, who've worked across departments and in close collaboration with colleagues in Colchester, we have a detailed report for you tonight. It outlines the emerging proposals and keeps the current Careline service running during what has been a challenging period of change. As portfolio holder, I've been given the authority to approve the final documents. I expect to receive a final report later this month, and if everything is in place, I hope we can complete the transfer in August. As the proposals before you tonight are emerging, there will be the need for updating and refinement, but I welcome the committee's scrutiny and input ahead of my decision, any decision I take. I'd like to thank Gary Guyver, our Corporate Director, and Katie Wilkins, our Assistant Director for People, for leading this work and bringing the report together. They'll be happy to answer any questions you may have. Finally, I want to express my sincere thanks to the Careline staff. Their commitment to our residents during this uncertain time has been outstanding. I hope we're now moving towards a clearer, more stable future, and one that builds on the strengths of the service they've worked so hard to deliver. Thank you, Chairman and members, for your time and attention. I look forward to our discussion.
Yes, please do.
Mr. Chairman. Councillor Placey, one of the things that I wasn't quite understanding when I read the report, and I might have missed it, but I couldn't see it. In regard to LGR, when we merge into 2 or 3 or 4 or how many different authorities, as this new service has moved to Colchester, does that mean then that there'll be other transition arrangements, and that as LGR takes place, the service will be merged into that new local government reorganisation? So in effect, what you have now in Colchester will only be in place 2 years until you move to local government reorganisation. And then when you move to a combined authority with Essex County Council services merging with Tendring District Councils, Colchester's, probably Braintree's, that another review will then have to take place so that we can then incorporate the service into the new framework. When I read the report, I didn't quite understand how that works in 2 years' time, because obviously you've got the shadow board, and although the report itself was very clear on how we were moving it to Colchester, it didn't seem to be very clear what happened in 2 years' time when Colchester dissolves into the new authority. So I wondered if you could just share some light on what happens then, what happens to the people, what happens to the staff, because obviously this won't be the Troopy arrangement, the movement to Colchester. This will be the one after. So I'm very sort of concerned to find out what happens to our staff and any of our residents that are part of Careline during that process, which didn't seem to be covered in the report.
Got a question, yeah? I'm not sure that we've got the information to answer that fully right now. Do you want to go onto that?
Yeah, if you could, Gary.
No, thank you very much, Councillor Griffiths. And it's a good question you've asked, because obviously all the discussion is about moving towards local government reorganisation, devolution. And what we have here is a proposition to essentially move one service to another, merge services ahead of that formal local government reorganisation. So the company, the holding company, Amphora, that delivers the helpline service in Colchester and beyond Colchester, and that is owned by Colchester City Council. That's an important point, owned by Colchester City Council. When LGR takes place and a unitary authority is created, those kind of holding companies that may have belonged to one of the constituent elements of the new unitary would essentially be part of that unitary. So, and for the helpline service that we're moving our staff and service users to, after LGR, they won't necessarily be the company owned by Colchester City Council. It will be the company that is owned by the new unitary and incorporated into that unitary. Therefore, there wouldn't need to be another process come 2028 to move the staff and the service users round again. What the Cabinet's decision that's already been taken here involves is almost getting ahead of the game in terms of LGR and moving towards that merger 2.5 years earlier than when it would happen by default. So I think the concern you may be raising, Councillor Griffiths, does this result in another process of transferring staff and service users a couple of years down the line? What we're doing by taking this course of action is doing that now, and it wouldn't have to happen again in 2.5 years' time.
Concern is that the main driver is to minimise disruption and inconvenience. Then what we're basically doing is minimising disruption and inconvenience for 2 years, and then the whole process starts again, because I'm struggling to understand how when you move maybe 3 district authorities into one, when you dissolve the county council and you have adult and children's services all coming in with different cost centres, and then you put a mayor over the top, how you're going to maintain the same
Chris, I think we're
structure.
going to pick up some of these questions.
And that's not answered in the report. And to be honest, although you've been very good at talking round it, you still haven't given us the assurance that I want. And I know the chairman's not happy because that's not one of the written questions.
Well, I'm not unhappy that people ask those questions, but I also I do believe that going forward at the moment we need to start unraveling some of these things. You know, picking up on IT systems that don't tally together. I think if we don't start some of this work, we won't get it done anyway. But I'll go back to Gary.
Thank you. No, Councillor Griffiths, yeah, we haven't explicitly written about that within this report. This report is very much about the transition to make the process happen. I would refer you back when you have the opportunity to look at the report that went to Cabinet in February, because that provided the full explanation of how this approach does work with the emerging propositions around local government reorganisation. And I'm happy to discuss with you after you've had an opportunity to look at that report if there are any outstanding concerns.
I have to say that before this meeting I did pull up the report from February and have a look at it along with this, just because I thought I might have missed something within the report. I still don't understand how that's coming together, but I'm sure given the amount of vulnerable residents we've got, I shall certainly be in contact with you to make sure that any residents in my St James ward are well looked after, because one disruption is with people that are 70, 80 and 90 is not sort of helpful. 2 is probably very unhelpful, especially to people that are concerned over their welfare and who's looking after them. Thank you.
Yeah, it could be a long evening, but let's come through the chair with questions, please, because we have got quite a few, and they aren't my questions. To reassure everybody, it's not something that I'm trying to sort of gerrymander through the system. The questions are the questions that have been brought forward. I mean, did you want to add anything to Councillor Placey's introduction to this before we go into the questions, Gary?
No, Chairman, I think Councillor Placey set the scene very nicely, but I'm happy to come back when the questions are asked.
So let's move into the questions, because I think some of your questions are in some of these answers as well, so we can pick those out, and I will be quite happy to take supplementaries as we go through from the main questions. So I think we'll go to Councillor Goldman first with the first question.
Thank you, Chair. Can the portfolio holder, just on the content, or considering the content of the report before this committee this evening, will there be new material to add to that?
Thank you. If you're happy to reply. Well, on the basis that, as it stands at the moment, this is a report from the Corporate Director myself to this committee, what I would say is what's being considered this evening really outlines the current emerging proposals for the transition. It is an opportunity for this committee to discuss, have an input, raise suggestions and put them forward. And on that basis, while we're not necessarily expecting any major changes to be made to the thrust of what's in the report, the likelihood is that there will be selective updates to certain areas of it, some refinement in certain areas, and within the written response it highlights some of the areas where we are expecting to have to refine going forward. So whilst the core content we think will remain broadly the same, the report that does eventually make its way to the portfolio holder will more than likely contain differences, a more polished version of what you have here. And on that basis, in terms of whether the call-in provisions would apply to the portfolio holder's decision at that time, we think that the report that the portfolio holder does receive will probably have sufficient differences from the material you have before you tonight, and will be sufficiently distinct that the call-in provisions would apply to that, and that's on the advice of the monitoring officer as well.
Thank you.
I was going to say, did you want a supplementary question as well?
No, that's fine at the moment. It's okay.
Right. And does anybody else want a supplementary question on that? No? Then we move then on to the next question, which is Councillor Newton then.
Thank you, Chair. I've got quite a few, Gary, and Gina, so I don't know whether you want to write them down and then answer them after. Right. Can you tell me more about the proposed use of Barnes House under the intended transfer of Careline? Will there be an obligation to use this site? What type of agreement will be put in place, i.e. a licence to use or a lease? And what obligations will exist to provide the service from that site and over that period? And what are the costs to the private company for the use of Barnes House? Thank you.
Okay. Thank you, Councillor Newton. So in response to that question, of course, you've got the written response before you, but the plan is for the helpline service to use part of the Barnes House accommodation in Pier Avenue, where Careline currently operates from, and it's to be used as a local base for the expanded helpline service. We would look to secure that arrangement through a short-term licence agreement as opposed to a formal long-term lease, running till the end of March 2026, but with the option to extend further as necessary. And the reason why that arrangement is being put in place for Barnes House is to ensure that the expanded helpline service can continue to provide a fast, reliable support across the whole of the district, with maintaining a local presence so that it can maintain and improve upon response times. May recall from the Cabinet's decision that the conditions around doing this transfer and the merging with the helpline service was very much around guaranteeing service coverage to residents across all parts of the district and maintaining, where possible, improving upon existing response times. So having a base for the responding staff at Barnes House, where they currently operate from, was a logical step. Now, there's no long-term obligation for helpline to continue using Barnes House. If the helpline team later finds that there's alternative accommodation in a more suitable location, they can move to that accommodation longer term. But the key requirements throughout is that they maintain a service to the whole of the tendering district. They're able to access residents in any part of the tendering area and the Colchester area, and that they maintain and improve upon those visiting service times. But for the purposes of this, a short-term licence agreement seems to be the right way to go. There are advanced discussions on that. It's relatively straightforward to put that in place. In terms of the cost, the licence fee that we would be looking to charge the company, That is still subject to negotiation. I'm not putting that forward in the public report as much. It fits in with all of the different negotiations around costs, fees and prices that are going on in the run-up to the transfer. But the discussions are quite advanced, relatively straightforward to put a licence agreement in place for that property.
And will we get a figure when them costs are decided?
Well, I think it may be there may be sort of some commercial confidentiality around it. I mean, for councillors would be able to access that information, but I will take that away and consider how public that figure will be made at the point that decision is taken.
Okay, thank you.
Anybody else want to raise anything supplementary on that question? No. Oh, Councillor Davidson.
Yeah, could you let us know how long the first licence will be for, please?
Yes, thank you, Councillor Davidson. Well, the intention is to run that first licence from the date of transfer, when that's achieved, through to the end of March 2026. So it wouldn't be a full year because we're part way through the financial year. But the intention would be to have a licence agreement that extends to 31st of March 2026. And within that time, if Helpline have sourced alternative arrangements, then that's fine, they can move on to that. But we would look to hold the option to continue and enter into another licence agreement if we needed to, so that they could remain in that premises for a longer period.
Okay on that one. So then we move then on to Councillor Griffiths. I've turned over 2 pages. Yeah,
I know you like to hear me, but I didn't think that Councillor Barrett would be.
Well, I thought I was on to that already. No, sorry, Councillor Barrett.
Thanks, Chair. Yes, so my question surrounds TUPE, or the transfer of undertakings relating to the protection of employment. So when considering the TUPE process, what does that guarantee the staff in relation to their new employer making changes after the transfer?
I'll pass over to the expert on this one.
Good evening, members, and thank you, Councillor Barrett, for your question. So, under the TUPE regulations, Careline staff will obviously keep their current terms and conditions of employment when they transfer to Amphora. This means, in terms of detail, this means that their pay, their holiday entitlement and other key employment rights stay the same. Now, should Amphora determine later on that they need to make changes to those terms and conditions, such as adjusting shift patterns, etc., they can only do this for valid business reasons, and they must consult with staff and their representatives, so they can't just implement these changes without that formal consultation process. The process is obviously designed to protect staff and also ensure that any changes are handled fairly and transparently. Thank you.
And a quick supplementary, if I may. So the ETO reason, which is economic, technical, or organisational, obviously is likely to come up in a business over a period of time, very likely, because economic, technical and organisational covers a grand number of reasons. Are we absolutely committed to make sure that union representatives and the employers are well represented in a very open and transparent way?
Thank you, Councillor Barrett. So, yes, absolutely. In terms of the current staffing arrangements, obviously we have been formally consulting with staff and their union representative, and we've actually gone a step further because of the proposals. We've liaised with the union chairman and we've put in a staff representative who works with the union so that they can be the voice on behalf of the staff. I don't anticipate that changing as they move into Amphora, because obviously that's an established process. It's not part of terms and conditions as such, but actually it's good practice. And, you know, we've been having those conversations with Amphora about how we make sure we support staff moving forward. As it stands currently, you know, as I've said in the first part of my response, the intention is for staff to go over on their existing terms and conditions, and that includes their current shift patterns and working arrangements.
That's brilliant, thank you. As somebody who's been TUPE'd twice, that does sound genuinely reassuring, so I thank you for that.
Yeah,
Second question for me from the pack. Could staff be better off being offered voluntary redundancy rather than transfer under TUPE?
Thank you again, Councillor Barrett. Now, this is a little bit more complicated because under the 2P regulations, voluntary redundancy can't legally be offered as an alternative to a 2P transfer if the only reason is the transfer itself, which in these circumstances, obviously, it is. The law is clear. When a service like Careline moves to a new provider, staff must transfer with it, keeping their existing terms and conditions, as I said previously. This protects their rights and ensures continuity of employment. Redundancy, voluntary or otherwise, can only be considered if there is a genuine business reason that is unrelated to the transfer, such as a restructure. So offering redundancy just because of the transfer would be unlawful, and it could lead to legal challenges for the authority.
That's great, thanks very much.
True or not? No. Right. Sorry, Bernie.
Yeah, under your 2P, yeah. Isn't that only guaranteed for the first year, those terms and conditions?
Thank you. No, what happens is those terms and conditions are guaranteed for an indefinite period unless there is, as Councillor Barrett said, an economic, and I'll give you the legislation, sorry. So unless there is a economic, technical or organisational reason for those terms and conditions to change. So it isn't about a set period of time. It's about, obviously, if there was a change that was required because of those reasons, then obviously they could change. But that is not, you know, where we are in terms of 2P, and employees' rights are protected.
Right, thank you. But the company itself, when they change over, that is subject to that company wanting to change those rules to suit themselves. Yeah, in respect of the employees.
So in terms of that company wanting to make changes, obviously, as I've just specified, there are 3 reasons for them, you know, if they did that. But again, they can't just enforce those changes, there would be consultation. If they were to enforce those changes, they would be open to legal challenge because of the protections around the 2P regulations. So, sorry, have I answered your question?
So under those terms, they would have the same union rights.
Absolutely, they would have the same union rights, and they would have the same employment law rights. So we're talking about statute, this is employment law. So absolutely, they would be protected. And as I say, any change, if Amphora proposed any change, it would have to have a very robust reason within those 3 headings I said to you, and there would also have to be a period of formal consultation. And under employment legislation, employers have an obligation to look at every other avenue as an alternative to redundancy. So, you know, those employees will be protected in the same way they're protected now.
Is that including pension rights as well?
So yes, their existing terms and conditions include their council pension.
Thank you.
Councillor Griffiths then.
Clarify, Kate. My understanding is that when you do a 2P move from a local authority to a private company, bearing in mind that the nature of that company changes, e.g. the management of that company changes, so you move, for example, where Ian Davidson is head of service to whoever is head of service in the new company. Surely, by the nature of that change and you adopting their new terms and conditions and policies, which you must have because you can't use TDC policies on another company, that in itself constitutes organisational change, doesn't it? That was my understanding. Could you just clarify if that's right?
Thank you, Councillor Griffiths. So, in terms of terms and conditions, key people policies and procedures are included in those terms and conditions. So, we, when we have been working with Amphora, obviously part of that work is saying our employees are on national joint council terms and conditions of employment, and obviously they have to transfer on those terms and conditions of employment. Now that does include, as I say, their local government pension. If further down the line, you know, our TDC employees become Amphora employees, and actually there are certain terms and conditions that are more, you know, they consider of greater benefit to themselves, you know, and they want to adopt those, they would have the option to harmonise terms and conditions. But again, it would be at their request. It would be there would be a period of consultation. They would have to have all of that information. So, in terms of the things that you're talking around, you know, policies and procedures such as occupational sick pay, that is determined for our employees as by national joint conditions, as you know, because you've previously been part of the HR committee, and they will transfer with those employees to Amphora.
After the transfer's taken place, a synchronisation of localised policies within the new organisation, so that what you actually do is you have a policy that is uniform throughout the whole of the new organisation, which would include terms and conditions and pay, because obviously you couldn't have existing Amphora staffing on different terms, pay and conditions to anybody that's been tupered into the organisation, which in our view would probably come under your organisational changes, which is one of the phrases I think that you used on changes of terms and conditions. Would that be correct?
Thank you. So, in terms of those terms and conditions, in actual fact, Amphora employees can have and will have different terms and conditions to TDC employees, because, as I've said previously, those employees will bring with them their terms and conditions of employment. So, that is down to Amphora to, you know, manage and communicate amongst their workforce. And actually, when Amphora came into fruition, the staff that joined Amphora were from the city council. So again, they transferred across on council terms and conditions, which included local government pension, etc. But actually, a number of them made the decision that they would like to transfer across to, because obviously when Amphora take on new staff, they'll be taken on Amphora terms and conditions, so ex-TDC staff. When the ex-Colchester City Council employees joined Amphora, as I said, they joined on their existing terms and conditions, but a number of them chose to move over to the Amphora terms and conditions because they considered for them and their personal circumstances that was of greater benefit. So, but again, nothing can be forced because these employees have very clear protection.
Councillor Codling, you had a supplementary.
Yeah, thank you, Chairman. Just a quick question. Do we know at the present time whether the TDC people have got the equivalent terms and conditions of the helpline people at the moment, or are one or the other, better or worse?
So, as I explained, there will be different terms and conditions, and one of the main differences in terms of terms and conditions will be the local government pension scheme. Amphora colleagues will not, anybody that chose to take Amphora terms and conditions or were appointed on Amphora terms and conditions will not have access to the local government pension scheme. And obviously, that for the council workforce, that is, a significant benefit. So again, there may be slight differentials in potential rates of pay, etc. But again, it will be for the employee to make a decision, a fully informed decision, that these are the conditions of Amphora, these are the terms and conditions that I'm currently on, and what I'd like to do based on, as I say, what's of rating to them. And what one person makes personally will be very different for another, in terms of what's of more importance to them.
Right, we then move on to the next question. Councillor Griffith.
What's a response to the transfer, and is the proposed transfer a good deal for the employees as well as the customers?
Thank you, Councillor Griffith. So, excuse me, as I said previously, been significantly in the consultation process, and have provided constructive feedback throughout. Their focus, like ours, has been very much on protecting staff jobs and ensuring the service continues to meet the needs of our residents. And we've appreciated their engagement and continue to work closely with them through the transition. As I explained previously, we've chosen, or the staff have chosen, a staff representative to work very closely with the union as well on this, because it's so important. So, but the consultation process has included one-to-one meetings with each and every member of staff. Actually, at the point of me presenting, I think there's one outstanding, but the union have been in attendance at each and every one of those meetings too. You asked me if I consider, or we consider the transfer as a good deal for the employees as well as the customers, and I would say yes. It offers strong benefits for both staff and customers. For employees, it obviously means their continued employment with no break in service, and as I've said a number of times this evening, they take with them all of their existing terms and conditions because of their protections under 2P regulations. And for customers, it ensures that the service continues without disruption, with a commitment to maintain or improve response times and also coverage in the district. And overall, the transfer aims to provide stability for staff and high quality care for our residents.
Do you want a supplementary, Chris?
Mr. Chair.
Both those questions were answered, so that's that one. So it moves on then to me. Are the services that TDC provide, such as fire alarm if a customer has fallen, medication, prompting reminder, personal alarm, got out of bed prompt, or being moved over as well,
Chairman, if you're happy for me to respond to that one. So yes, all of the services provided, including personal alarms, fall detection, medication reminders, bed sensors, fire alarms, and including support for sheltered housing residents in our area, will transfer over to the helpline service provided by Amphora as part of the move. And a lot of the discussion that the officers have been in with colleagues in Amphora is establishing the technical means by which that can happen as smoothly as possible without the customer really even noticing any change. And those sort of technical discussions and explorations very, very advanced, and we've worked out how to do that. The sheltered housing scheme, and the management of sheltered housing for tendering has been closely involved in the project team that's been exploring how this is all going to happen, making sure that nothing is being missed in the transfer, and that the handover is as smooth and as well coordinated as possible. And ultimately, the goal is to ensure that our customers continue to receive the same level of support with no disruption to the service that they rely on. And that's been a key focus of all the exploratory work that's gone into the transition plan we have before us.
I was going to say, I mean, in the early days of us consulting with residents, I mean, I had two people I went to, and both of them were more concerned. I mean, at that time, we perhaps hadn't given enough information, and there was sort of possibilities of it maybe being based in Scotland or whatever. And some of the concern was about who's going to lift me up when I fall. I mean, I did notice in the report that we're talking about at least keeping response times the same as they are and maybe improving on it. How are we looking to do that when it may be based further away?
Thank you, Chairman. So the provision of the mobile responders hub at Barnes House is a key element of that, so that you haven't got a situation where responders working for the enlarged helpline service necessarily have to travel all the way out of Colchester city centre to reach and meet the needs of a resident in Clacton, for example. The idea, although the control centre would be run from Colchester, there would be responding staff operating within the tendering area to maintain those times throughout. And interestingly, the helpline service provided by Amphora already serves a number of tendering residents. They're not just confined to residents within the Colchester area at the moment. So actually the helpline service is already present in the tendering district, and there are a number of customers previously from the tendering district that signed up to helpline rather than tendering's careline service, and going forward helpline have been signing up new customers from the tendering area looking to the future.
I mean, that is quite positive. And I mean, just one last question. I mean, it really goes back to Councillor Griffiths. As we move forward, you know, we will need a local hub, because I totally agree with that. And I mean, your answer is what, you know, I sort of assumed anyway. But what about going forward a bit further? What provision may there be for Barnes House being transferred to the unitary or whoever takes over?
Thank you, Chairman. One of the reasons why Barnes House is being provided to Helpline on a short-term licence agreement is because it does keep the option open for Amphora, the company, to establish what is the best means by maintaining those response times across a wider North Essex area. And it may be that they look to relocate all of their operations to a location that is mutually accessible for the wider area. At the moment, they operate their control centre in Colchester Town Hall, and of course we have Barnes House. There is flexibility and scope for them to look to establish new premises at a point in the future when it's established what the best location is. That will be a decision that they can take, but the principal conditions of this transfer, which is part of what we would work into the heads of terms for the legal agreement, is that commitment to maintain service provision to every inch of the tendering district and to maintain those service times. And what I would say as well, one of the things that the helpline service does provide, which the careline service hasn't provided, is that all responses are by two individuals. So each response that goes out, they have two members of staff that go out to visit. So you've got a bit of resilience there as well. And actually, as a result of that, the quality of the service, you could say, benefits from that, because you've actually got two people going out on each call.
Excellent. Does anybody else want to add a supplementary to that question? If not, I'll then move on to Councillor Steady then.
Okay. Yep. Thanks, Chair. Yeah, you've all done very well so far. It is noted that the contract does provide CCTV monitoring. Can we have an update on where the council is with the Safer Streets funded scheme for the expansion of CCTV coverage? When will this CCTV scheme be completed? And are Colchester aware of the scheme and the additional work that this will arise as a consequence of the additional cameras?
Katie's the one leading on this, so I'll pass you over.
Thank you, Councillor Steady. So I have been working with officers in terms of the Safer Streets CCTV expansion, so I can provide an update this evening. There is a more detailed update in the written record of responses, but just to give members an update that the expansion is progressing well. Most of the work involves upgrading existing equipment, as members will be aware, and all necessary agreements are in place, with the exception of just a small number of licences from Essex Highways. And that's just, those requirements are just for 4 new poles on public roads. So these are the final pieces needed, and while there's some delay, we're pushing for a resolution as quickly as possible in terms of the ECC team, and their monitoring officer in particular has been hugely helpful in that. If the licences are issued soon, then the project should be completed by late summer or early autumn. And Fora are fully aware of the scheme and the work programme, and they've already met with our technical team and also the contractor that's been appointed to undertake the Safer Streets project. So the plan for this extra monitoring has obviously been factored into the transition discussions with Amphora. So, and I know there was a supplementary question asked in terms of the pre-questions, Councillor Steady. So would you like me to answer that, or are you happy for me to answer that now?
The one concerning the PFCC?
Yes.
Yeah. So obviously, just to make everybody, and for the recording, is the PFCC aware of the transfer of the operation? And the CCTV cameras going to a private company, has legal advice been sought to grant terms? Yep, so you're ahead of the game.
Thank you. So officers have determined that the detailed arrangements for the monitoring of the system are not pertinent to the bid, obviously, and the criteria supporting it, and there is no reason, obviously, to believe that service provision will be diminished in any way. So we will still continue to satisfy the requirements of the bid, the PFCC bid. Thank you.
Thank you, Katie. No other supplementaries on that one? Then we move then to Councillor Goldman again.
Turn this on. Yeah, I think you've answered the question of the CCTV as such, and I think I'm going to be going into the realms of the next question, which is to do with data protection in respect of, obviously, the CCTV is being held under our responsibility, and in respect of Amphora, how is that data protection going to be protected, new and old?
Thank you. So members will be reassured that data protection is being very carefully managed by Gary and I, and tendering will remain the data controller for the CCTV system. We're working with specialist legal advisors on the data protection requirements around the transfer to make sure that obviously we have the right advice and we are legally compliant. This includes the work that we will be doing with our external legal advisors will include reviewing Amphora's privacy policies, drafting a specific data protection agreement, and ensuring that all roles and responsibilities are clearly defined, and that will include those around the CCTV code of practice as well. So I'd just like to reassure members that that work programme is already underway.
Thank you.
Right, and you had no supplementary, because I think we've missed one out though, haven't we? I think that was regarding, and I'll ask Councillor Newton to ask that then, regarding the maintenance, I think.
Okay, I'll ask Bernie's question and he'll ask mine. Thanks, Councillor Burney. Regarding the maintenance with the existing CCTV, who is responsible to maintain the cameras, communication lines and screens?
Thank you, Councillor. So TDC will continue to be responsible for maintaining the CCTV system more broadly, and that will include the cameras, communication lines and screens. Only the live monitoring of the footage is being transferred to Amphora. Damien Williams, a member of the strategic management team, who you will all know, I'm sure, he will remain the lead officer for CCTV, ensuring that our systems stay well maintained and fully operational.
Okay, thank you.
Unless anybody wanted to pursue that, we would leave that alone then. So it comes back to Councillor Griffiths then.
Chairman, what assurances are being given around staffing levels for Careline following the transfer?
Thank you, Councillor Griffiths. So Amphora already operates a flexible multi-skilled team that are able to respond both in terms of control and also mobile response. So they flex their resources accordingly in line with service demand, which obviously this approach helps to ensure consistent coverage and quick response times. Our TDC employees who will be transferring, they will, should they wish, have the opportunity to develop new skills, but there'll be no requirement for them to change roles should they not wish to be multi-skilled. The aim will continue to be, obviously, to deliver a high quality service while supporting staff stability and development, and Amphora will continue to flex their resource accordingly around those employees who are transferring in.
Thank you, Kate. I would remind you the question is what assurances are being given around staffing levels. Now, as you're aware, staffing levels is the number of people. Although I understand that if my colleague falls off his perch and I take his job over, that makes me multi-skilled. And if somebody else falls off their perch and somebody else trains up for them, that gives us flexibility in the workforce. What that in effect means is instead of having 4 people, you only have 2. So the question is that if we're transferring people actually to the service, are we retaining the actual number of bodies there, or don't we know? And whilst I accept that it might be possible to be able to train other people to cover different roles, the number of staffing levels are different from staff flexibility and being multi-skilled, because one person doing numerous jobs is multi-skilled and flexible. What we're asking there is if I've got 2 people or 4 people in a team, are we still liable to have 4 people in a team, not 2 people covering the other 2 people's jobs that aren't there? I look forward to your comments.
Okay.
Thank you, Councillor Griffiths. So Amphora, like us, have a bank of casual staff for instances such as you described. So if they had 2 members of staff who fell off their perch, as you say, they would be able to quickly backfill those resources with their bank of casuals. The beauty of their workforce being multi-skilled and multi-trained means that they can bring in, they can flex resource accordingly. So if they have casual mobile responders available, then obviously those casual mobile responders can pick up that, but then staff can then be flexed on control should they need to be, because they're fully trained in control. So actually it gives them greater resilience. So hopefully I've answered your question, because that is a question that Gary has been keen to ask, around service delivery, and also because, in terms of our Careline service, the staffing levels have been a challenge. So we've wanted to have that reassurance for members that, there is that capacity there.
Thank you, Katie. Right, I think it now comes back to me again. So, what are the customer levels at now in comparison to prior to this whole matter commencing? Are new customers being accepted?
Thank you, Chairman. If I take that one.
Yeah.
Thank you. So, if we look back to when the Cabinet received its report in July 2024 around the review, at that point, Careline had just over 1,800 customers, 1,859. As it stands at the moment, that number is down to 1,336. Now, during the review of the service, Careline, we paused taking on new customers during that period while the future of the service was being decided. But since the Cabinet's decision in February, where there was clarity around what the future of the service would be, we have been signposting any prospective new customers to the helpline service because we are going to be merging together. And so those new customers in tendering, looking for this service, have been directed to helpline as it is the Council's trusted partner in providing the service going forward. So while Tendering District Council Careline hasn't been signing up new customers directly during that period of time, Helpline has, and they're already growing the customer base in preparation for the full transfer. And as I mentioned a little bit earlier, they've already had a presence within the tendering area, and they're growing their customer base as we speak at the moment, irrespective of the fact that our current customers will transfer over to the service provided by the combined helpline service going forward.
I was going to say, I don't really want to keep going backwards, but why? I'd had some concern at the start that the consultation we first did with people about changing the service, why we weren't stronger in encouraging people maybe to be looking at Colchester, because as I said, I attended two people who were most concerned. One happens to live in my road, and they were very confused by, why would I want to, use an operator in Scotland or wherever some of these were. And I said, well, probably you wouldn't want to do that. Perhaps you ought to be looking at Colchester because it's just up the road. Why? I'm sort of concerned going forward that we don't take our existing users with us properly because, we don't properly consult and explain to them, the opportunities that are there strongly enough, because I don't think we did it early on.
Thank you, Chairman. So you'll recall from last year when the review was being carried out, we weren't taking on any new customers at the time. At that point, the Council and the Cabinet were still exploring different options for what the future of the service should be, ranging from whether we carried on as we are, through to whether the service ceased entirely. And under those circumstances, it would be our customers would have to find providers elsewhere. Now, we weren't in a position at that time to specifically name Colchester Helpline as the preferred provider because the analysis of whether that would be the right option for those service users was still in the process of being carried out. When we returned to Cabinet in November of last year, having received the results of the consultation, it was clear that the customers really wanted stability and continuity going forward. We had a proposition from Helpline that they had the opportunity to step into that space and be the trusted partner. But by due process, we needed to consider other alternatives before we could jump to naming Colchester Helpline as the preferred provider. As it transpired, when we brought the report back to Cabinet in February of this year, we had done that analysis, we'd done that due diligence. It had become clear for a number of reasons that Colchester Helpline was the best option. And from that point and that Cabinet's decision, we were openly able to start signposting our customers to Colchester Helpline, knowing that we had fully looked at if that was the right option for them.
Yeah, Anne.
Thank you.
Sorry, it's just something I read earlier on. Obviously, for the people that don't decide to carry on with us, presumably there's only a few of those, is there? That's one question. But also, when our new contract starts, presumably their date finishes then, and then what happens to all their details, etc., that all gets wiped out, etc., through the correct channels. And also, are you able then to give them a quick extra support in other areas where they can go for Careline? Thank you.
Thank you, Councillor Oxley. Excellent questions, because this has been very much at the forefront of our mind in how we move forward with the service. As it stands at the moment, we don't know for sure how many of our 13 or 1400 service users are satisfied with transferring over to Helpline or would want to explore the opt-out provisions that we've got in the draft letter. But from the results of the consultation, and we have continually throughout the process communicated with our service users at each stage, even in the run-up to key decisions, we've let them know what we're recommending to the Cabinet, then we let them know what the Cabinet have decided, how long it would take to come to the next decision. And what we haven't had is anyone coming back raising in particular concern about that. In fact, we've had people coming back sort of reassured that that is the option that we're looking at. In terms of how the transfer takes place, the contracts that we have with all of the individual service areas that are served by Careline would be what we call novated through a legal transfer to the Helpline service. So we are taking legal advice on making that happen. Those legal advisors are already looking at that and have been looking at that as we speak. In terms of the data held for the customers that do transfer over, the technical means by which that transfers over is being dealt with at the moment, and there will need to be a data sharing agreement to allow that to happen in legal terms. For those customers that decide that it's not for them, and for whatever reason that they want to opt out of transferring over to Colchester's expanded Helpline service. One, we've worked some time into the timetable to be available to offer support and guidance as to other alternative providers that might be in the market. Now, I hope that this is going to be the vast minority of service users, because the advantages of the Helpline transfer are so clear. But what would happen to their data is their data wouldn't transfer, wouldn't be kept on the Helpline record. It would be removed from the Helpline record. But under legislation, as Tendering District Council, we would still be required to hold on to their data for a period of 2 years, just in case there was any query or concern or issue that came up in the future that we needed to look back over our records for.
I've got another question, but just on the transferring the data over, I mean, I don't think there are any other questions that can come up about it. I mean, there is a certain technicality to transferring the data over to the new organisation because they are slightly different. Will there be some demo running of that computer system? Because, you know, technicality of maybe moving from one to the other might be one thing, but will we be doing dummy runs to make sure that having transferred the data, the new system is going to, you know, operate? Because I think the danger is that, you know, the day one we go to run it, you know, everybody's data's been moved over and then it won't run.
Thank you, Chairman. No, that's a very good question. And yes, what we're doing at the moment, we're in discussions with both the software provider for the database that we use as Tendring District Council, the database that Colchester uses, owned by the same parent company, interestingly, but different in some respects. What you don't want to have is a situation where you leave everything to chance and then on day one you find out that the data hasn't transferred correctly. So those bodies are already on notice to carry out a number of test runs for this data transfer. And as it stands at the moment, our staff are running through all of the data on our database to make sure that it's tidy and where it needs to be, so that those runs can be started. And we're looking to do that as soon as we possibly can, so there are no big surprises right at the end.
Excellent, because it's nice not to have big surprises. Right, my next question is, how do we think we're going to complete the transfer by the 1st of August 2025 if we're only at the heads of term stage now?
So, yeah, no, thank you, Chairman. So we are aiming for the transfer to take place on the 1st of August 2025. We're working very hard to stay on track for that date. The draft heads of terms that you have before you tonight as part of the report appendices are the result of several months of detailed work with Amforum, covering key areas like staffing, IT, as we've just discussed, service delivery. We've also been working closely with legal advisors who are ready to move forward with the formal agreement, who are cited on these emerging heads of terms, albeit understanding that they are emerging, and they will be advising us going forward. So while we're, of course, keeping this timetable under close review, as we've noted in the report, we believe it's important to have that 1st of August target in there. It gives clarity to our customers, what we're aiming to do, reassurance to the staff, and it helps to avoid some of the risks that could occur if there were delays in terms of staffing shortages, service disruption, which would become more acute if there are further delays. So there are real good reasons to be pushing for that 1st of August deadline. That said, we've got to be realistic and pragmatic about this. If anything crops up from the work that we're continuing to do that changes our view on whether that date is achievable, we'll be open about that. We'll report that to the portfolio holder with the explanation as to why we think it may take longer with a revised plan. But as it stands at the moment, the efforts are very much around making this transition happen as smooth as possible within the timescales that are set out here and avoiding undue delay.
I was going to say, because a lot of the discussion tonight have been about staff, but I think vulnerable people need to know where they are, and I think anything that creates uncertainty for the users is so important. So I think that would be my concern. Now move on then again to Councillor Steady.
Thank you, Chair. Can you confirm to us what the overall impact on the council and the budget will be for 25, 26, 26, 27 and 27, 28? And how does that compare to the envisaged position prior to the possible closure of Careline being raised at Cabinet?
So thank you, Councillor Steady, and you have the detailed response set there within the papers before you tonight. But the proposed transfer in total for the period we're talking about is expected to cost the council in the region of £900,000. That's over the 3 years from 2025-26 through 26-27 and 27-28. Now that's made up of the one-off implementation costs, which we're estimating at £744,000, and a projected revenue cost £155,000 within the first year, the current year, 25-26. So if we put that in context, if Careline had continued unchanged in the scenario that was part of the earlier Cabinet reports, the projected cost to provide that service would have, over that 3-year period, would have been in the region of 1.7 million. If the service had been closed, which was obviously one of the options as part of the consideration from the review, and the council would have retained in-house only the out-of-hours and the CCTV monitoring element. There would still have been a cost to the council because it needed to provide those services. So the total for the projected 3-year period would be about 1.2 million. So the comparison there, if I just reiterate those figures, the cost of what is being proposed here, approximately 900,000 over a 3-year period, compared with if we'd have carried on providing the Careline service unchanged, 1.7 million. And if we had ceased Careline but retained the out of hours and the CCTV monitoring element in-house, a cost of 1.2 million. So the current proposal is positive in relative terms to those options that were considered earlier, and certainly more cost effective than closing the service altogether and only retaining part of it in-house.
Yeah, thanks. I must admit, when I first got the report, the first phrase I wrote was, "What's the alternative?" And I was a little bit worried about, some of the options. But I think what is very relevant is what you just said, because I know we're trying to look after our residents, but also there's a financial implication as well. So the way I read it is, although we're going to make savings in the long term, the level of service for our residents is going to be better than what we're providing at the moment. So I'm very reassured by not just what you just know, but the whole meeting tonight on the overview and the questions you've answered, and I think that's a credit to the team. But I've written down something else here, because obviously we said we're going to pass it over there. So, and I might have missed this. So there's an updated report coming for the final. So, and I'd be guided on this. So where's the scrutiny? Where's the scrutiny? If that's going to come back, is that going to come back to this committee? Is it going to go back to Cabinet? Is it going to come back to us on our work programme? Or would be, you've mentioned the calling. Would it be prudent then, don't know whether I should be saying this really, that once the report is done, we do it as a matter of course to call that in, which would then become the scrutiny? Am I completely bonkers?
Chairman, may I thank Councillor Steady for his question. I'll thank him after the meeting as well. Just in relation to calling, I think it would be not an appropriate use of call-in facilities to effectively say whatever the decision that the portfolio holder takes, we're going to call it in. Both committees are considering your work programmes for 25-26, and there is no reason why you can't say that you would like to have some sort of post-decision scrutiny or monitoring, some form of inquiry that potentially will either look at different elements of any transfer, both for those receiving the service, so you could therefore be asking for some form of survey to be undertaken of those people who have transferred over to Helpline on the basis that is the decision. And the position in relation to staff, you can ask for that information to come back to the committee as part of your 25-26 work programme. And I think at this stage, that's probably the considerations that you should be contemplating as you consider your work programme for 25-26. That's not to negate the call-in facility, and you heard at the very first question that if there are councillors that are concerned and they follow the call-in procedures, then potentially that can be called in, and that is what was said in that opening question, or the response to the opening question, is that the call-in facility will exist in relation to this, and therefore no councillor is being disadvantaged by virtue of this scrutiny being undertaken this evening.
Come back.
Yeah, I've got another idea. So, if we're going to transfer over to Colchester, so will the portfolio holder in any way have any conversations with Colchester over that 3-year period to act as like a scrutiny on the decisions we've made, and if it's gone in as we thought it should be, and then you could come back and report back to the scrutiny committees to just really build on the positive story, no, they're not positive story, the positive facts which we've had tonight.
Gina.
Yeah, that has been spoken about, and that's these two have done so much work and met with so many different people, and part of it being a merger and having the support of the North East Essex Alliance keeps our involvement, if you like. So I have got that opportunity to make sure that things are happening as we say they should. Yeah, very much so. I mean, like you say, and the emphasis is on making sure the service is there, the service is provided, and also our staff that they're happy. So yeah, I'm sure that's what we've been talking about all the way along, haven't we? And especially if we've got an outpost in tendering, that makes it even easier. Yeah.
Yeah, I'll just get Keith to come back in.
Yeah, Chairman, I just wanted to obviously just also think about your work programme for next year. And one of those considerations that is in the pot at the moment is for the chairman of the Overview and Scrutiny Committees at this council to meet with the Overview and Scrutiny Committee chairman for Colchester and with Braintree. So it may well be the case that working collaboratively on that some element of scrutiny can be undertaken around helpline, and that might be a joint scrutiny. It may be that one or other is doing it, but that is in the pot at the moment, and hopefully that will address your issue that scrutiny will take place of this service going forward.
So you happy with that, Grant? Yeah. Good. Because I think that's a good idea. Because I think back in the scrutiny training that we had probably a year and a bit ago, there was much discussion about scrutiny, on different councils working together for the common good. So I think that would be good. Right. I think the last question, I believe, is Councillor Griffiths, but it almost sounds like your question you opened the day with.
Well, I've rewritten it, Mark, so you're all right. Right. So you're like this. Is it better to hold on to Careline and limit transfer changes till the shadow authority is set up? This is particularly due to the vulnerability of customers who would only have one upheaval, and staff who would have one transfer to the new local authority organisation whose structure would be then set up. So this would then not only may help maintain staff's pay and conditions, but also anyone that's transferring into the new organisation would have the structures already set up, so they'd know what they were paying for, know what the services were, and know what staffing levels are, and what the flexibility and multi-skilling are of the operatives working for it.
Excellent. Gary.
Thank you very much, Chairman.
For rewriting, Mr. Chairman.
That's very good, Councillor Griffiths. Very good indeed. I mean, we did touch on it earlier, of course. I mean, the key thing here is that the decision to transfer Careline to Helpline, the merger, was made by the Cabinet, fully aware of the emerging proposals around local government reorganisation. And in fact, LGR was one of the main reasons why we were moving forward on that basis to provide a stable long-term solution ahead of any of the wider solutions. As I mentioned earlier, we're essentially getting ahead of the game on this. and the top priority through this is protecting the service quality and continuity for our customers. As you say quite rightly, Councillor Griffiths, many of whom are older, vulnerable residents. My concern is that delaying the transfer has the potential to cause even more uncertainty and disruption, especially if the issue has to be revisited again in a couple of years. So what we've been doing is we've been keeping our service users updated on all of the stages of the review and what the attention is going forward when the different meetings are coming up and the key decisions coming up throughout the process. They've been made aware of the proposed merge with Helpline. We have been quite consistent in that messaging going forward, and we'll look to be consistent going forward. My concern is that changing course now, if anything, would add to the confusion and anxiety for those residents. And of course, there are good reasons why the decision has been taken to go for the merger. I mean, financially, we touched on it earlier, continuing Careline, even if it's for a couple of years, would require some quite significant ongoing subsidy, as we looked at in the figures. And we would still be required to invest quite heavily in upgrading the equipment for digital purposes, even if we were only hanging on to the service for a couple of years. There's a sense in trying to do that in a comprehensive manner through the merging with Helpline, with an eye firmly on the local government reorganisation that is going to be happening in 2 or 3 years' time. Helpline demonstrated that it offers a more sustainable model financially and for other reasons as well, and with the ability to operate at scale and deliver service across the region. As I mentioned earlier, Helpline is already present providing service to tendering residents beyond the Colchester border. The wider aspirations about health and well-being as part of the Health and Wellbeing Alliance, there is a sense in merging together because one of the key objectives of that alliance is to have an integrated approach to service delivery, and there's no better way of doing that than actually being on the same page and delivering a consistent service across boundaries, and that's what we would be looking to do here. So my fear is that delaying for a couple of years has the potential to cause more disruption and uncertainty. Moving forward now gives our customers certainty. They're already aware of what's happening. It protects the staff jobs, puts the service on a stronger footing going forward, hence the decision that the Cabinet took. And our attempts through the transition plan and the heads of terms we have here to make that transition as smooth and seamless as we can, but appreciating there are always going to be some bumps in the road.
Did you want another supplementary? Mike.
Thank you, Chairman. Yeah, thanks for that overview there, Gary. Yeah, is the numbers really that's always been a concern for me. We know that Careline for some time has hemorrhaged money for efficiencies, and it's good to actually see some form of transition. But what sort of concerns me, and I just try to, we talk about 1.3 million, 1.2, could be 1.7. What definitive cost is in that? I mean, because what concerns me is the unknowns. The unknowns moving forward. You say there's going to be a benefit by the year 3. Actually, it's a 438,000 deficit, or whatever it was, over that period. But what I can't understand as well is that on the actual costs now in this first period, it's $750,000 as a one-off cost. Why does that have to be paid in year 1? Why couldn't that be distributed over a period of time? And the next part of that question is regarding digitalisation contribution. Now, if I wanted to join the Helpline service, what are those costs? We're contributing 50%. If someone joins Helpline, they will pay their monthly fee as I've got to buy a device cost. I don't understand that, or if they do or don't. And then one thing that caught my eye was the letter that we sent out to residents regarding the service costs and the monthly fees. that at the moment are £23.82, they're going to go to £30.55. Now, some of these people are really struggling. So we're now seeing a 17, I think, was it a 28% increase in terms of the monthly fee. How will that be perceived with a drop-off, which will affect the whole equation and the delays going forward? These are things I see on a practical level, but obviously first and foremost is actually the cost guarantees that we ain't going to be slipping up to 1.3 million or 1.7 million. We're saying it's going to be 900,000. So, I'm not going to hold you to it, but I'm just saying I just need that. And if it does start escalating out of control when we get to that point, I think the committee needs to see it. And then we need to report back if we've lost the budget control of it, and we know we're going to be facing costs, a bit like spendles. We need to get that view, and I don't. That's my personal, because it's state payers' money, and we'll make certain we have got control. We know where we're going in the transition. I agree a lot with Councillor Griffith says, is that we're going for this transition into with LGR and combined authorities, and I just fear that we're going to have two lots of operational change costs here. And where are they going to be sitting in year 27, 28? I know some of these are a bit much, but it's things that go through my mind is how we're going to approach this. And these are sort of significant costs. I mean, it's great to see savings. I can see that, but it's still front end we're paying for that. Is that okay? Thank you very much.
Yeah, let Gary answer it.
No, thank you very much, Councillor Bush. You're absolutely right to ask that question. So the budget that's been set aside for the transition and implementation of the change was agreed by the Cabinet. Now, that budget would have been there if the Council had decided, for example, to close Careline completely and to only operate the out-of-hours and CCTV element. Under that circumstances, that £750,000 implementation budget would be spent on different things in terms of supporting the transfer. A lot more resource going into supporting customers to find alternative providers, for example. Whereas the proposition that you have in the report here, the costs that are set out within the table are based on relatively advanced discussions that have followed on from understanding what are the technical requirements, what are the likely costs going to be. Now, they're given as round figures, so there's always going to be some flex around that. When we bring a report back to the portfolio holder for the decision, there may be some refinement around that. One of the advantages potentially of looking to an August transfer date and upfront payments for provision of out-of-hours, CCTV monitoring, and a clear definition of our contribution towards that digitisation is that if that's worked into the legal agreement and those monies are paid over in August, there should be no comeback from that. We've paid the contribution that is due, and the cost is the cost. From that point on, it's for Helpline and Fora to make sure that the funding is utilised to maintain a viable service. What I would also say is that there is options there. You could either pay that sum of money up front as a transition payment, which is what's proposed here, utilising that one-off budget. The other alternative is that you do pay it for the out-of-hours and the CCTV as an annual fee for each of the years up until LGR or beyond. But in doing it this way, we're also building in a bit of resilience to inflationary increases as well. And, the risk to tendering district council in many ways is less because we know what the payment is, we've made it up front, there shouldn't be any comeback from that. Whereas if you spread it out over a longer period of time, you may have an issue with creep. Of course, once we've done the sums in more detail, and we're bringing something back to the portfolio holder to sign off, if we found that there are issues in there that weren't part of this report that are just the costs, then you have that opportunity to look at whether that needs to be looked at again through scrutiny. But the basis of these figures is based on quite advanced discussions about what the likely costs would be. So that's that element. In terms of the digitisation and the devices, we are already part the way through a programme of upgrading customers' devices from old style analogue to the new style digital devices. And in so doing, it's within their contractual terms, the monthly service charge does increase from 20 something pounds to 30. And that has been what's happening for our existing residents that have gone from the analogue gear to the digital gear. What the letter suggests here is that everybody's got to be upgraded to digital at some point. In transferring over to Helpline, we are providing a financial contribution to Helpline to make that happen for the rest of our customers. And in so doing, their existing terms and conditions, which transfer over as part of the agreement, still apply. And then when their device goes from analogue to digital, as at the moment, their price goes up to £30 instead of £22. But what I would say is that even at £30, that is still a pretty competitive price for this kind of service compared with what's out in the market. And even what sort of Helpline provide to their new customers that they bring on. So even if it goes up to £30, because their terms and conditions are transferring over, that's as high as it will go, subject to inflation going forward. So there's some assurances around that. But again, just to come back to the point, in firming up what that financial contribution should be, and looking to pay that in year one rather than spreading it over 2 or 3 years, it gives us a bit of clarity about what that cost is, and if there is any increase and creep up, you know, that risk is not on Tendring District Council, because we've worked out what it should be, we've made that payment, and then the onus is for our colleagues in the Helpline service to utilise that money in the most efficient way that they need to.
Gary, over this concept of a one-off payment, I mean, my understanding was that if you spread the payments across 2 or 3 financial quarters, in the event of you making a single payment and then the service not meeting your desired expectations, you have very little leverage. Whereas if you, within your contractual obligations, set it up for 3 staggered payments, if after year 1 you don't like what's happening, when you come to year 2 for your financial contributions, it gives you some leverage to say, hang on a minute, as part of our agreement, you said that you would do this. Clearly, by the evidence that that hasn't happened. So until we actually see you meet your requirements, you're not getting year 2 or 3's payments. Now, surely, wouldn't that be not only more cost effective, but prudent, so that in that way we safeguard our, if you like, investment, rather than one lump sum where once we've paid it, it's then very difficult to control subsequent events should they not meet your contractual expectations?
Thank you, Councillor Griffith. A really good question, and one that we've been thinking about very carefully. And I think this comes down to what is worked into the legal agreement, and also whether or not the City Council is a party to that legal agreement. Because although by doing a one-off payment at the beginning, you know, that safeguards sort of the financial interest of tendering, because we've got a clear budgetary position. For the reasons that you've rightly stated, we need to have clear parameters about what our expectations of performance are. And because we are partners with Colchester City Council as part of the alliance, we need to be able to have some comeback on that. So through our discussions with our legal advisors, what we want to make sure is that we safeguard against that kind of scenario where you've made a big upfront payment, something's gone wrong, and there's no way to sort of withhold some of that pending a resolution to that issue. So we're looking very, very closely at how that is worked into the legal agreement, so that there is some comeback, there is some scrutiny, and the role of the City Council potentially as our partner in making sure that that funding is utilised in that way. There are pros and cons. There are always going to be pros and cons of different approaches, but safeguarding against the kind of scenario that you've just highlighted is something that we're looking very closely at with our legal advisors.
Would it be possible to shall we say, suggest that as a recommendation because we're not suggesting that we don't give them the finances. What we're suggesting is that we stagger the financial payments over the 2 or 3 year instalments to allow us to ensure that the contractual obligations that they promised us are met. And that at this early stage, as you haven't done the transfer, could be quite easily written into the agreements, because we're not substantially saying to them you can't have the money. All we're saying is that we're quite prepared to give you our share, but it will be upon these dates and on these instalments. Because bearing in mind on LGA anyway, we're not going to be here after 2028. So that does give you the leverage of up to that time to work out a payment plan of when you look to pay the money across, and it also allows you to ensure that the contractual obligations are being met and everybody's happy.
Thank you. I think that is useful feedback from the committee. Now, there are several means by which that could be achieved. I think the legal advice that we take is key to that, because we want to make sure that we're doing the right thing in terms of how that money is administered. Whether that is staggered payments direct from the council, would have to make sure that that implementation budget is maintained for the full 3-year period. We don't want it disappearing, otherwise we're not going to be able to pay for it if the budget disappears. So that kind of safeguard would have to be in there. And whether there is a role for the City Council as our partner in the administration of that. But as a principle suggestion, that we need to look very closely at how the money is provided to avoid those kind of risks. That's something that we'll look very closely at with our legal advisors, and that's useful feedback from the committee. Thank you.
All right, Chris?
As a recommendation then. Thank you.
Actually, I've got one other question. Looking at the letter that we're talking about as well, which you've just made reference to, so I looked at the letter, and I mean, one of my concerns goes back to the initial consultation, that there were people out there that were definitely slightly confused by what was going on, and we are talking about vulnerability, etc. And I just wondered with some of the wording, I mean, the last paragraph says you might, however, be contacted by one of our colleagues. I mean, shouldn't we really be definitely contacting rather than we might? And I mean, the other comment that I'd had from this was that we have talked elsewhere in the actual whole document where we talk about this increase in the cost because of digital, and that, to be clear for members and other people, is that that cost was going to happen anyway, because if TDC had kept the service in-house, we would be changing that digital equipment as well. But the letter doesn't really make it clear that that's not an increase because we're suggesting you move to different things. It's just saying there is an increase, and I think picking up on Councillor Bush's comment is that as a selling tool almost gives the impression we are increasing it, and in all honesty, it doesn't really highlight that we have to change this equipment because we're turning off the analog signal. It talks about 2G and 4G, but I have to say at least one of the residents that I spoke to early on wouldn't have a clue what 2G or 4G was, and that somehow this letter needs beefing up or thinking about, because I think vulnerable people, A, won't understand 2G and 4G, and we haven't really made it clear that this cost increase would have happened to them anyway. And I just think that actually suggesting that we might contact you isn't good enough, because I know there are people out there who are saying, well, has my equipment been changed? Do I need to contact anybody? Is it all going to turn off, and am I going to be left vulnerable? So that's my...
Thank you, Chairman. I mean, we could certainly look very closely again at the wording of that letter. I mean, the point around, do we make it clear that this has to happen because there's a big change happening, perhaps isn't as clear in the letter as it needs to be. You don't get a sense for why it has to change from analog to 4G. So we can certainly look at the wording from that. That is useful feedback. Something that we were very conscious of when thinking about communications and the content of this letter was the fact that we know that the upgrading's got to change, and if we had left that element out of the letter, allowed the transfer to happen, and then our colleagues at Helpline started going around contacting people saying, right, now it's time for you to upgrade to digital, your price goes up from £22 to £30. We didn't want that to be seen as something that is equated with the changeover. You said we were going to be on the same terms and conditions. You've transferred us over, and the first thing they've done is changed it. What we wanted to do is be open and honest about that from day one, that you're on your same terms and conditions, which does include an increase in price for digitisation. But I think what we'll take away is that's clearly a concern. So we'll look very closely at the wording of the letter. One of the other things that we have looked at is whether this has to be a one letter that goes out to everybody, or whether there are two versions of the letter, one that goes to people that we know haven't been upgraded yet, and a different version that goes to the people that have. I think the complexity is around it. You want to get that right. You don't want to, for whatever reason, send the wrong letter to one customer and confuse them. So what we've attempted to do here is one generic letter that covers all. But I think we'll take back that critique of the letter and see whether there's something we might be able to do about that.
And just one sort of other thought I'd had with that is that, I mean, I'm sure other councillors were called out by residents anyway because they were concerned with what was happening. I'm quite convinced lots of people have had contact with. But I just wonder whether there was actually a process to make use of councillors to help in the changeover, the support for, you know, vulnerable people. Because, you know, having been called out by two people, you know, there's only 1,300. So I presume that lots of other people had it, and it'd be almost worth, you know, if we could do it, actually saying who your local councillor was, just to, you know, because that's someone else we can use. We know we're short-staffed potentially, you know, with what's happening, and it's going to be a busy changeover period, that we make use of the councillors as a resource.
Thank you. Useful feedback. We'll consider how we could approach that.
Mike.
Yeah, thanks, Mark. Just want to come back regarding the agreement, the partnership with Alfora and Colchester. I assume when we talk about potential stage payment costs and relating to performance, I would assume that if we've got engagement with officers from here and from Colchester, within that agreement, there's got to be some monitoring of key performance indicators, which could be a part of a platform for dealing with things like delayed or stage payments, because if it's out of hours, there's got to be set parameters there. They've got to respond and deliver, same as in a response to the call outs for the vulnerable. So there's got to be a whole matrix in there, I would have thought, that we could build on. So we've got a very open, transparent agreement, and we know it's fair and equitable to all parties. That was really, I assume that was going to happen within the agreement.
Yeah, no, thank you, Councillor Bush. Absolutely right. We have a draft specification for the out-of-hours element, which relatively high level at the moment. As I sort of highlighted in response to the first question, there are elements of this that will be updated and refined. And part of that is within the out-of-hours specification, having some performance criteria so that we know and we can be reported on and have an indication of whether, you know, Helpline is adhering to the service standards that we want to, and that's the basis for scrutiny going forward. It's not fully developed within the specification, which is part of the pack now. That's certainly being worked on at the moment. And of course, within the legal agreement itself, there will be red lines and expectations of the District Council. And the principal headline ones, of course, being the 100% coverage of the geographical area of tendering and maintenance and improvement on response times.
And I've just got one more comment looking through here. Out of hours support draft specification. One of my pet hates is we've used acronyms in there and we haven't outlined what they mean in the first time it's used. So we use OOO, you know, which is obviously out of hours, you know, out of hours serve. But then we also mentioned ECTU, which I presume is Essex County Traveller Unit. But the one I didn't understand was Chubb.
Yes, I mean, Chubb is the company provider of alarm service. Uh, yeah. No, we'll give it a thorough review of acronyms. I'm not a big fan, and of course, with my planning background, the whole world is full of them, and it's a pet hate of mine as well. So we'll certainly review the documentation and try and reduce some of those confusing three-letter acronyms that
No,
don't make a lot of
I think
sense
we
on
can
their
have
own.
them in. It's just that I think every document should have it once written in full, isn't it, before you go on. And actually, one of it, because it was the one with the ECTU, I was thinking about these other services that we get out of ours, and one of those is unauthorised encampments.
Yes.
And it's one thing that I've used as a councillor before, in that it talks about internal staff access only, not for public. Now, I understand that it's not for public use, but are councillors considered internal staff? Because I've certainly used it in the past, and I just wondered whether that would be a poorer service, because that's one of those things that as a councillor you do use out of hours, and I was just wanting to check that internal staff include councillors.
I might have to take that one away because it's going to depend on what the service area is. But I think the point is, no, the point is well made. And what we'll do to supplement the out of hours specification, there will be a list provided to Helpline and Fora, which would probably be confidential because it will include telephone numbers of sort of specialist contacts that we wouldn't normally put out in the public domain, but they need to be able to operate the job they're doing. But for some of the services, if they are publicly accessible numbers that anyone can call upon, then of course we will have access to. But there will be certain contact details, numbers that will be solely for Amphora as the provider of the helpline service to keep safe as they provide that service for the council going forward.
Thanks for that, Gary. And as there's no more questions, I think, thank you, Gary, thank you, Gina, thank you, Katie, for coming. I think we will have a comfort break if we want for 5 minutes, say 10 minutes. Yeah, back at past. We then need to come up with some recommendations. We've picked up that one and we'll look at recommendations for us to vote. But thank you very much and have a good rest of the evening.
Thank you, Chairman. Thank you, Member.
Thank you. Look forward to getting them.
Right, welcome back everybody. I hope you enjoyed your break. Now I'm going to ask our Assistant Director to read a recommendation that we've pulled together from your comments, and hopefully you'll agree with them.
Thank you, Chairman. I think the committee wanted to record that it recognises the difficult issues and decisions that have been faced by the portfolio holder and officers in this matter, and that from what it has heard, the committee believes that service users and staff have been at the forefront of their thoughts throughout. That the committee thanks the portfolio holder and officers for submitting the report to tonight's meeting, for attending it and talking to the report contents and answering questions on the transitionary arrangements. As a rider to that, there was reference to the fact that the implementation costs would be £900,000 in 25-26, and the committee would urge that if those implementation costs escalate significantly, that a report is submitted back to it to enable it to undertake further scrutiny of any decision. The committee noted that there is still a great deal of work to be undertaken, to be completed, prior to any decision to authorise the transition arrangements set out in the report, including in respect of things like staffing levels, the arrangements for the use of Barnes House, the Safer Streets CCTV extension project, and the data sharing and protection issues around CCTV obtained data. The ensuring that service user data transfer to the new provider is entirely successful, and that the communication with service users is improved around its certainty on a number of points, and that it includes reference to the national ending of the analogue telephone lines as an explanation around the charging regime. On the back of that, the committee expressed concern about the potential transfer date of the 1st of August 2025, given the range and complexity of the issues that still needed to be resolved in advance of the transfer. Fourthly, that the committee felt that the funding of the intended agreement should not be by virtue of a single instalment in 25-26, but split over that year and 26-27 and 27-28 in order to enable performance by the provider to be monitored and appropriate steps taken. However, if a single payment was to be pursued by the portfolio holder, that the agreement should be clear and firm in its mechanisms for securing a clawback should performance failures be identified. Chairman, that, I think, was the recommendation.
Right, thank you, Keith. Does anybody want to make a comment or maybe move the recommendation? You're happy to move it? Yeah, so it's moved by Councillor Bush and seconded by Councillor Ferguson. Can I have a show of hands for those in favour? I think that's unanimous. Thank you. And thank you to members and officers for an entertaining evening out. And I wish you a good journey home. And I'm sure you've got other things to